Hi, I'm Dr. Lee Rogers. I'm a podiatrist that specializes in wound healing, and I've been the medical director of several wound centers. I'm going to walk you through what to expect on your first visit to a wound center. A wound center is typically a hospital-based outpatient center where highly trained nurses and physicians of multiple specialties are working together collaboratively with the most advanced tools to heal your wound as quick as possible. Wounds have many causes, but the most common are diabetes, venous disease, and pressure. On the first visit, bring your health insurance card, any previous medical records, and your medication list, especially if you're going to a wound center that's not within your primary health system because they won't have access to your electronic medical records. Depending on what kind of testing is required, the first visit can take up to 2 hours, so be prepared. After you check in, you'll be brought into a room where a nurse will ask you questions about your wound and your health and perform an assessment, which includes taking measurements and a photo. The doctor will want to know how long your wound has been present, if you know what caused it, and what other treatments have been tried. The doctor may order blood tests, a wound culture, x-rays, or tests on your circulation. One of the standard treatments is a debridement. A debridement is performed with a sharp instrument like a scalpel or a curette. Debridements remove any bad or non-viable tissue from a wound and start the body's healing process. And you shouldn't be in any pain with a debridement because the wound can be numbed, or in certain cases like diabetes, there may not be any feeling in the wound at all. A debridement may even be performed on your first visit. In some cases, pressure will have to be removed from the wound, and this may involve using a special cast or a boot. If pressure is not removed from the wound, it won't heal. Compressive wraps may be needed to help reduce the swelling in your legs or improve the function of your veins. Other specialized tools that wound centers use are grafts or hyperbaric oxygen, and occasionally surgery is needed to get a wound to heal. The team will choose a dressing for your wound. Dressings are variable, and some are changed once a week and others are changed multiple times a day. Pay careful attention to the instructions and ask for a written plan. Visits to the wound center typically occur weekly. The wound will be measured, photographed, and any progress noted. Another debridement may be performed, and the wound dressing orders may change. But these weekly visits are typically shorter than your first. Your wound healing team is there to help you heal as quick as possible. But a lot of this healing is dependent upon you. If you listen to your doctor and your nurse, you'll have the best chance of healing.